Well, tonight, the expiration of enhanced tax credits under the Affordable Care Act continue to weigh on millions of Americans. Thank you for joining us for First Coast News at 5:30. I'm Heather Crawford.
And I'm Ginny Blaylock. Those tax credits saved families hundreds, sometimes thousands of dollars. But now a big question looms. What is next for those feeling the impacts?
Freha Abrar is live now to break down what this means for families here on the First Coast. Freha?
For millions of Americans, the cost of health insurance can be a burden, especially now at the beginning of 2026, after tax credits from the Affordable Care Act expired and removed financial help, lowering monthly premiums for families. The ripple effect, according to experts we spoke with, could be devastating.
A lot of people then choose not to sign up for health care. And we're going to have more people who are uninsured. And when that happens, then we start to have issues because people start using the emergency room, hospitals as their source of primary care. And that is clearly not the best way to stay healthy.
Affordable Care Act subsidies first expanded during the pandemic, helping cover the gap for people who don't qualify for Medicaid but still struggled to afford private insurance. But at the start of 2026, those credits expired after lawmakers failed to reach a deal to extend them. Now American families are dealing with the impact.
The biggest change that I've seen has been strictly with the insurance and how the premiums are going up. I've also seen the change with patients of not wanting to be a number and calling and waiting 6 months to get into their primary care provider.
Jacksonville's chief health officer, Dr. Sunil Joshi, says more than 100,000 people in the city are uninsured. And he says that number is only expected to climb as premiums go up.
We never expanded Medicaid coverage in Florida. So we had the most people in the country signed up under Affordable Care Act health insurance in Florida than any other state.
More than 20% of Floridians, or 4.7 million people, are enrolled under the ACA. Now, it's important to note the original subsidies from the 2010 Affordable Care Act are still in place, but are less significant. Now, as traditional insurance becomes harder to afford, some patients are turning to direct primary care, where patients pay a flat monthly fee for access to a provider like Dr. Ashley Russell at NOLA Care.
Can't afford something you can't afford. You have to choose between having a home, having food, having transportation to get to work, and just hope that you are well for the entire year. Your kids don't get sick. So that shouldn't be a choice people should have to make at all.
Now, the House is scheduled to vote on a 3-year extension of those ACA subsidies on Thursday. If it fails to move forward, those higher healthcare costs could be the reality for millions of Americans for the foreseeable future.